Welcome to another episode of the What Is video series, where I attempt to break down complicated topics in 5 minutes or less because my 3 sons say that 5 minutes is the most anybody should have to look at me. I am your financial strength coach, Darryl Rosen, and for this video, I have some very exciting news to share with you. Viewers, allow me to introduce financial novice Darryl. Financial novice Darryl doesn't know anything about Medicare. And if I'm being honest, he doesn't really know anything about anything. I heard that. Why the silliness? Because this topic is super dry, and I like to have fun. So let's get to it. Financial novice Darryl, what are we going to talk about today? How about Medicare? Interesting. Why Medicare? We're 55, so we're eligible, right? Okay, this video can't come soon enough. We'll talk about eligibility in a second. You wrote up a list of questions, right? Look, I made a picture. Not the drawing of our family, the questions. Okay, I'll be serious. We're going to cover what is Medicare, what does it cover, what does it not cover, what happens if you're still working when you want to start taking Medicare, and a little bit about what it costs. Medicare is health insurance for people 65 and older, and certain people under 65 with disabilities. Medicare is a national health insurance program that helps with the cost of medical care, but it does not cover everything. There are 4 parts in Medicare. Part A is a hospital insurance that helps pay for inpatient care in a hospital or skilled nursing facility, some health care, and hospice care. Part B is medical insurance that helps pay for visits to doctors and other healthcare providers, other outpatient care, some health care at home, durable medical equipment, and some preventative services. Part C, Medicare Advantage plans are approved third-party health plans that combine Part A and Part B coverage and may include some prescription drug coverage as well. Part D helps pay for the cost of prescription drugs. Now, there are many variations. Some we'll hit on later, but the breadth of your coverage is decided by the choices you make, most notably base Medicare versus Medicare Advantage. Unfortunately, this is a pretty long list. Would it cover the cost of a hair transplant? Maybe the viewers can help me decide which style looks better for me. Darryl, you're gonna look awkward no matter what hair choice you make. Here's what Medicare doesn't cover. Most dental care, eye exams for prescription lenses, dentures, cosmetic surgery, acupuncture, hearing aids, and routine foot care. And this is the big one. Medicare does not cover the cost of long-term care. What about medical marijuana? Is that covered? Why do I even? No, I'm being serious. People use CBDs and medical marijuana to feel better. Weed, pot, grass, dope, reefer, ganja. You Googled slang terms for marijuana, didn't you? I did. Medicare begins at 65 years of age. You're right, we are too young. I just did the math on this calculator. We have 10 years to go. I'm not surprised you needed a calculator for that. When you turn 65, you have what's known as your initial enrollment period. It lasts for 7 months, starting 3 months before you turn 65 and ending 3 months after the month you turn 65. Unless you're currently receiving Social Security or Railroad Retirement Board benefits, say that 10 times fast. When you turn 65, you'll have to sign up for Medicare yourself. Medicare may not notify you about your eligibility, so be sure to get your initial enrollment period dates and put them in your calendar. It's best to sign up for Medicare towards the start of your enrollment period. This way, your coverage will begin as soon as you're eligible. If you sign up during your 65th birthday month or later, your coverage start date could be delayed. If your employer has 20 or more employees eligible for health insurance coverage, and the coverage is similar to Medicare, you can delay enrolling in Medicare Part B without penalty, even if you're over age 65. You can also choose to enroll in Medicare to fill in any gaps in your employer's health insurance. Are we almost done with this? Can't you see I'm busy? Yes! Most people don't have to pay premiums for Part A if they or their spouse worked and paid Medicare taxes. However, you'll have to pay a premium for Part B if your annual income is above a certain level, and you may have to pay an additional monthly charge. Premiums for Part C, which is Medicare Advantage, and Part D vary by plan. There can be differences in deductibles, out-of-pocket yearly maximums, and benefits. For example, a Medicare Advantage plan can cover some additional dental and vision services. When the time comes, you'll choose between standard Medicare, Medicare Advantage, and even something called Medigap, which is known as supplemental insurance, that helps fill in some of the gaps. Darryl, we're out of time now. Tell the people where they can get some more information. Thank you for watching our video, What is Medicare? If you need more information on Medicare, Medicare.gov is a great resource for you to get some information. Also, AARP has very good information as well. If you like what we're doing here at Get Financial Strength, now, please like or subscribe or leave a comment, and we'll see you soon.